Hello. Many of you have shared your concerns and had questions about this new virus. So today I have Dr. Twyla Twillie here with me from Baptist Operation Outreach, which is a joint program with Christ Community Health Services to provide quality health care to the homeless. So Dr. Twillie is here to try to address some of those questions and concerns about the new virus. Dr. Twillie, what is the virus? If you get it, will it kill you?
Well, the virus is called coronavirus, or you may hear it being called COVID-19, which is the same thing. It's just two names for the same virus. This is a new virus that has rapidly spread across the world, and it can be easily passed from person to person. The person has the virus, they can spread it to another by coughing on them or sneezing on them, or even if this happens where they're coughing and sneezing on their things. The virus can make a person really sick and they might even die. That is why you see so many people wearing masks now and people washing their hands so often.
Well, how would I know if I have the virus?
It can be hard to tell. Some people don't know they have it until they get tested or they get really sick. But paying attention to how you feel can really help. You want to watch for fever, cough, and shortness in breath. These are the most common symptoms, but you might also lose your sense of smell or your sense of taste, especially if you have diarrhea with that. That can be really concerning. If you notice any of these things, or if you start to get where you have trouble breathing, your chest hurts, you feel confused, or you're so tired it's hard to get out of bed, you might have COVID-19.
How can I find out if I have it?
The only way to know for sure is to get tested.
How can I get tested, and is the testing free?
Well, there are several places you can go to get a free test. And I'll just call the list off for you real quick. You can go to Baptist, Case Management, Church Health, Christ Community, Memphis Health Center, North Fraser Community Health Center, Tri-State Community Health Center, or you can go to the fairgrounds where UT Health Sciences is running a center to test. Now, to help figure out where you should go, you can call COVID-19 hotline. That number is 1-833-943-1658. Again, that number is 1-833-943-1658. And you can call from 8 a.m. to 4:30 p.m. Monday through Sunday. Now, when you decide to go, don't just show up. You need to call the center to let them know that you're coming, because they'll need to give you an appointment. And the people on the hotline will give you the number so that you can call.
What is the test like?
Well, it's a really simple test. We use a little swab that looks like a tiny Q-tip, and we'll put it inside your nose to get a little fluid sample that we can send to the lab. The test itself only takes about a couple of seconds, and you should get the results back in a few days. Now, this test will not give you the virus. Remember, we're just getting a little fluid sample. There's no shots. We're not putting anything into your body. We're only taking a little sample. And honestly, the test is a little uncomfortable because you think nobody wants a swab in their nose, but it's not painful. And it's the only way to find out if you have the virus.
Well, what happens after I get the test?
Well, it depends on your results. If your test results are negative and you don't have the virus, someone will let you know. Then you just need to continue to wash your hands, try to stay away from sick people, wear a mask in public, and keep at least 6 feet away from others. Remember, getting a negative test does not mean that you can't get the virus later, so you still need to be careful. You want to make sure that you're washing your hands for at least 20 seconds and that your mask covers your nose and your mouth. Now, if you test positive, which means you have the virus, for our homeless patients, you don't have to worry. You will be moved to a place where people are there to help take care of you, and they will be able to recognize when you get sick enough to go to the hospital. While you're sick, you'll need to avoid public places, stay away from people and pets, make sure that you're drinking lots of water, wear a mask, Wash your hands often and cough or sneeze into your elbow. Doing these things can help you keep from spreading the virus to someone else.
Thank you so much. Excellent information. You have answered many of the questions, but all this just seems so unreal.
I know it really does. And you hear about it so much and all the wild things that seem to be happening, but this virus is very real. It's not a joke, it's not an internet scam. This is a very real virus and it is potentially deadly. So you want to be really careful about trying to protect yourself and other people by getting tested. Jan, I hope I've been able to answer all of your questions.
Yes, you have. You have answered many of the questions, and we thank you so much for coming and doing this and answering the questions, concerns, and we hope that it has been informative information to many of the questions that have been asked. So thank you again, Dr. Twillie, for taking your time out to do that today.
All right. Before I leave, let me give the number one more time. The number is 1-833-943-1658. It's been my pleasure, Jan. Thank you.
You.